Hey there, Dr. Condit patients. So today we're going to unpack your Prosomnus case. If you are getting your case for the first time, you're going to see everything comes in this nice big brown box. So let's familiarize ourselves with what's inside. Inside, you're going to find a box with your patient records. This is your models and impressions that we originally took. It's good to hold on to these, store this box in your closet high up and label it, don't throw away. If you have some dental work done, you're probably going to need those at some point, just to make sure that your appliance always fits around new dental work. You're also going to find this blue box with this removable lid with several trays inside, and you're going to find your appliance itself in its case. You'll see that each bag that's inside is labeled with like a serial number, but it's also labeled with a U0, an L0, an L1, a U1. These are the positions of the trays, and they are marked on the side of the appliance itself, but this is what we're going to tell you each visit, what trays we need to change out and how we're going to advance you. In our office, we also include these orthodontic elastics. I'll show you that in just a minute. You're going to see an AM aligner or a morning aligner and bite tab. This isn't made yet. There's a video to come that'll show you how to make this and customize this to your mouth. And then a blue bite tab. And so these things are to help you get your bite back in the morning, and we'll show you more about those in just a little bit. So let's take out your appliance. Your appliance itself is going to be in two pieces. You can kind of tell if it's upper or lower just by simply the size of the teeth and the size of the tray. But you'll also be able to see that number and letter combination I mentioned before etched in the side. Don't know if that's hard to see on this video, but it is etched in the side of the wing itself, both on the upper and lower. And then when you match them together, the lower tray is always going to be in front of the upper, and you just put the trays together like so. In our office, Dr. Condit also loves these little clear acrylic hooks. These are what the rubber bands are for. So just like when you had orthodontics, you'd put your trays together, you would put your rubber band over the top and then over the bottom to hook them together. They're little elastics right here. They come in different sizes. You can order extra of these on Amazon. Just make sure you order a similar size or strength, just kind of based on what you like. If these are pulling the trays off of your teeth in the middle of the night, you need to talk to your sleep dentist about either relining these trays or getting a better fitting tray. So that would be something to address with your office specifically. But these are intended to help you do a couple things. They're intended to help you muffle snoring faster. They're intended to help you keep your mouth closed instead of your lower jaw dropping open and you drooling over your pillow in your sleep. And they're also intended, and the biggest intent is probably to help force you to breathe through your nose rather than your mouth. We know that the air is cleaner through our nose and we breathe better through our nose rather than our mouth. So that's what the biggest intent is. We recommend that our patients try the bands first a few nights and then try them without them a couple of nights and see what they like best. And so we'll probably walk you through in person how to put these in, but you're basically, if the bands are on, it is easier to put it in as one piece. You're always going to insert in over the top teeth first and then slide your lower jaw into the bottom. You'll notice as we advance you and move you more and more forward, these wings are different widths, and so your lower jaw is going to be more and more forward, and you're going to have to stretch that lower jaw and that muscle a little bit to get into a different position when you put it in. When you do put it in and take it out of your mouth, make sure that you do that in one even motion. You don't torque it to one side or snap these trays against each other. They will make a click. You might break a tooth. So make sure you're always taking it in and out of your mouth evenly and seating it all the way on your teeth. Some people will also have to kind of insert their finger in their mouth and kind of push the tray up over their teeth really well. So that's basically it. A lot of people, when they travel, we do recommend, because it clinks around in your case. This tray is strong. The appliance is strong, but they're breakable. Maybe wrap that in a paper towel when you're carrying it or traveling it with it. Always carry your aligners in the case with it. Maybe a few extra rubber bands, and then keep your package handy with all of your extra trays. Don't throw these away. And then when you come into your office for adjustments to your sleep dentist office, make sure that you're always bringing the tray, the appliance itself with your case, and all the extra trays with you. No need to really bring this big brown box or the models or impressions or anything. So that's basically it, guys. That's a tour of your appliance, your Prosomnus appliance. Each one is made a little differently, but this is ours. And there are more videos to watch about how to make your AM aligner, how to check your bite, how to clean your trays, and then of course we always like to walk patients through in person, trying that tray in and making sure it fits properly. So if you have any questions, give us a call. We'd be happy to help. Thanks so much.